Me llamo Silvia.
My name is Sylvia. I'm from Honduras. I have a family in Honduras. And my mom, she works making bread.
She has congenital scoliosis, so she was born with multiple deformities of her spine, and they appear to be progressing.
And I wasn't growing, and also I wasn't walking very well. At the beginning, I was having pain. But in Honduras, they would put pads on me, moist pads.
I am originally from Ecuador, and I know what growing a developing country is, and I know the needs, and I know how fortunate we are here.
This is something that she never would have been able to have there. Partly because of the complexity of the surgery, and I think partly because of the length of it.
I felt very happy when I was selected and that my body was going to be good again.
Oh, she's a delightful little girl. She's great, and she was, full of joy and so happy to be here, and so happy that we can help her out.
I loved her from the get-go because the minute I walk in, she's like, "Where's the bathroom?" And where do I need to put my suitcase? And she just made herself at home. And then she just sat down and started playing with the kids. And I was like, who is this child? Like, she has no family here. She doesn't speak the language. She's 14 and she just sits down and starts building a puzzle with my kids. So it was great. It was great.
Me gustó mucho la familia.
I like the family a lot. They're very special and they're very fun to be around. And I'm very grateful.
Every case like this, they all have something special. I think with her, it was more her spirit.
But those doctor's appointments are rough because as a host parent, you don't know the doctor and you don't know the history, and you're asked all these questions that you really don't know a lot about. With Sylvia, we're guessing. Allergies? I don't know. And that's scary. You're then like, I don't know this child very well. Nobody really knows this child very well, but yet they're having a very, intense, serious procedure.
Part of what we do as anesthesiologists is we have a very short time period usually to meet patients and get their history and help them feel at ease before you go back to surgery. Speaking the same language makes a big difference.
The doctors are very friendly and they're very nice.
She was ready. She was anxious to get it done.
And then the day of surgery, they made special accommodations to make sure that someone was there to help us.
So the treatment that she had is posterior spinal fusion, which is basically trying to correct a little bit the deformity, but mostly is to stop the progression of the deformity.
No, now it doesn't bother me anymore.
And then she would ask questions like, if I was to come to America, where could I go to school and how could that happen? And things like that, which, and that was to become a nurse. So, she knew later in life, maybe this is an option she would like to look at.
I would like to go back to Honduras to study and become a nurse and come back here and work to help my family back in Honduras.
And here at 14, she's figuring it out.
It is the full experience, for her to come here and seeing different environments in other people, seeing what it's being done in other places, it's a different perspective for her.
We're going to look back on these pictures, and the 2-year-old may not remember Sylvia, but she's going to be, now who was she? And we'll be able to talk about it. Well, actually we had this special person in our life, and this is what we learned from her, and this is what we can gain from it.
We're always happy to help. It's part of our mission to serve the community, and that whether that happens to be someone from another country that's here that couldn't afford it otherwise, or someone here in town.
I would like to say thank you very much and that I'm very grateful to everyone who helped me.